We are in the 9th month of this pandemic, and the nation is still setting records. 98,000 COVID patients are hospitalized. It's putting an increasing strain on our healthcare system. Medical personnel pleading for help.
There is no way that the hospitals can be fully prepared for what we're currently facing. This is like a natural disaster occurring in all 50 states at the same time.
The number of cases have doubled since November 1st and tripled since October 1st. The country's leading infectious disease specialist, Dr. Anthony Fauci, is warning we may see the full effects of a Thanksgiving surge right before Christmas.
We might see a surge superimposed upon that surge that we're already in.
Help is on the way in the form of a vaccine, several of them. And today, the Centers for Disease Control's Advisory Committee voted 13-1 for healthcare workers and residents of long-term care facilities to receive the vaccine first. A stunning number, roughly 40% of American COVID deaths have come from nursing home staff and residents. But not everyone in these groups will be getting it initially.
There isn't enough vaccine to go around at this time. And so each individual institution will need to decide how they're going to prioritize that vaccine.
Pfizer and Moderna have sought emergency FDA authorization. The vaccine rollout expected mid to late December. The federal government has said the vaccine will be offered free of charge.
What's important to note is the number of doses, the amount of vaccine that we have is still limited in comparison to the needs. So it's going to take a while for all Americans who need it on a priority level to get it.
So when will the general public have access to the vaccine? Projections vary. Early spring is being the most optimistic. The summer is more likely. Also tonight, the CDC has revised its guidance on quarantining. Now, currently, if you have been exposed to someone infected, you're advised to isolate for 14 days. But now that is changing. If you can get tested soon after being around the infected individual and the test is negative, you will only have to quarantine for 7 days. Without a test, it's 10 days of quarantine. I'm Shirley Chan for Pix 11 News.